Hi, hello, I'm Dr. Sudhakar, working as consultant radiation oncologist at AOI. Today I'm discussing about lung malignancies. Lung malignancies, what is a lung malignancy? The lung malignancies are the malignancies which develop from the lungs tissue. Basically, these are the tissues which line the air passages of lung. So what are the types of lung malignancies? If you look at, there are varieties of lung malignancies which we see. So basically divided into non-small cell lung malignancies and small cell lung malignancies. Non-small cell lung malignancies, again if we divide, we can see adenocarcinomas, squamous cell carcinomas and large cell carcinomas. The other variety is, as we discussed, it is small cell lung malignancies. So what are the risk factors for lung malignancies? If you look at, there are a variety of factors. First thing we all know, it's because of smoking. And there are different kinds of smoking. That's active and passive smoking, and there are chemical exposure also, asbestos, arsenic chemicals also, and there are kind of air pollutants also which can cause lung malignancies. If you look at the hereditary factors, there is a minute percentage of hereditary factors also which can lead to lung malignancies, and certain infections like HIV and other infections also sometimes can lead to lung malignancies. So what are the symptoms of lung malignancies? If you look at, there are a variety of symptoms we see in lung patients. Initially starts with cough, which is not relieving by medication, and long-lasting cough, and breathlessness sometimes. Some people even present with chest pain, and sometimes even if disease is advanced, we can see other systemic symptoms like bony pains, headache, vomitings, neurological symptoms, loss of appetite. These kind of symptoms usually patients presented with. So, how to diagnose these lung malignancies? If you look at, there are a variety of diagnostic modalities are available. So, whenever patients of clinical suspicions, you have to do clinical and general examination. And then you have to, first initial investigation is chest X-ray, and if any abnormality in chest X-ray, you have to do other radiological investigations like CT thorax, and if there is any suspicious mass, then you have to decide which modality to take biopsy. Some based on the location of the tumor, sometimes we do bronchoscopic guided biopsies, and even sometimes like endoscopic guided biopsies also, like EBUS. And if tumor is more peripheries, then we can go ahead with even CT guided biopsies also. There are other investigation modalities like staging investigations, what we do for other areas to rule out. Basically in bone, we do bone scan, and even liver investigations and ultrasound, simple ultrasound also we can see liver metastasis. And if patient has any doesn't have any financial factors, even we can do PET CT also to rule out a distant metastasis. So based on this investigation workup, then we can stage the disease into accordingly, like we all know that stage 1 to stage 4. Based on our staging workup, then we go for treatments. If you look at the treatment options, stage 1, so basically it's a very small tumor. Based on the location of the tumor, we can select it as a central or peripheral tumor. If it is peripheral tumor, the patient is a candidate for surgery, we can go for surgery. Whereas the central tumors, and if patient has any contraindications for surgery, even we can give a radiation. The radiation basically we deliver in the form of SBRT. SBRT, it's not like long course radiation. It's a very 3 to 5 days of radiation, and we can deliver high amount of dose based on the small size and location of the tumors. Then in stage 2 cancers, again based on the stage 1, as I discussed, it's like radiation or surgery, and this patient is not a candidate for surgery. We can go for definitive chemo radiation. As I said, it is a long course radiation based on the tumor size. In stage 3 is a locally advanced tumors. There are treatment options available like neoadjuvant chemotherapy. Initially, we give chemotherapy to reduce the size of the tumor. Then we proceed with the definitive treatment. That's like radiation, sometimes even surgery also, based on the location. And stage 4 tumors, we all know it is an advanced disease. Stage 4 is a metastatic disease. Based on the metastasis, we do investigation, we do other immunohistochemistry profile markers also, like EGFR, all GRAS mutations, and even now like for immunotherapies also, other immunohistochemistry markers. Then based on these immunohistochemistry profiles, lung panels, we proceed with either targeted therapies and sometimes tyrosine kinase inhibitors, and immunotherapies also available based on the staging of the lung cancer. So after treatment, like is there like can we prevent lung malignancy? If you look at, yes, not in all cases, because if you look at the developing countries like Indian scenarios, if you look at most of the patients presents with very advanced disease. So in case of any clinical suspicion, then always consult doctor, get proper workup, and find out in case of any lesion, then doctor will take care. In case of like prophylaxis part, if you look at, so knowing your surroundings, like if you are a smoker, you have to quit smoking, and if you are living in any polluting environment and all, you have to know your risk factors, you have to avoid those risk factors to prevent lung malignancies. Thank you.